Have you ever wondered how to interpret an ECG? It's a skill that might seem daunting at first, but with a step-by-step breakdown, you can start to understand the secrets that lie within those complex lines and waves. Firstly, familiarize yourself with the ECG paper. Standard ECG paper speed is 25 mm per second, and the voltage calibration is set at 10 mm per millivolt. This means the height of the ECG waveforms is measured in millimeters and corresponds to a specific millivolt value. Once you have that down, it's time to assess the rhythm. Is it regular or irregular? Look for consistent spacing between the R waves. The presence of any pauses, skipped beats, or abnormal beats also needs identification. Next, measure the heart rate. This can be done by determining the number of R waves in a 6-second strip and multiplying by 10. Or, if available, count the number of R waves in a full minute. The fourth step involves evaluating the P waves, which represent atrial depolarization. They should be upright and uniform in shape. Any deviation from this norm may indicate atrial abnormalities. Following this, analyze the QRS complex, which represents ventricular depolarization. Its duration should typically be less than 0.12 seconds. The presence of any abnormal Q waves, which may indicate a previous myocardial infarction, should also be noted. Next, evaluate the ST segment and the T wave. The ST segment is the interval between the QRS complex and the T wave. ST segment elevation may indicate myocardial ischemia or injury, while ST segment depression may suggest ischemia or repolarization abnormalities. The T wave should generally be upright and follow the QRS complex. The seventh step involves assessing the PR interval, which represents the time it takes for the electrical impulse to travel from the atria to the ventricles. The normal duration ranges from 0.12 to 0.20 seconds. Subsequently, evaluate the QT interval, which represents the duration of ventricular depolarization and repolarization. The corrected QT interval, often calculated using formulas like Bazet's or Friederich's, accounts for heart rate. Lastly, look for any additional abnormalities, such as bundle branch blocks, atrioventricular blocks, or signs of chamber enlargement. Also, assess the overall ECG morphology and compare it to normal patterns. Bear in mind, this guide provides a basic approach to ECG interpretation. Accurate interpretation requires practice, clinical correlation, and consideration of the patient's symptoms, medical history, and context. If in doubt, always consult with a healthcare professional. They can provide a comprehensive interpretation based on the specific clinical scenario.